Thanks, Katara. So just to give you an idea of what to expect from today's session, we're going to do a quick introduction to the legislation. We'll talk about the requirements for the pandemic operations plans. Then we'll talk about why you might need the plan or definitely need the plan and how you might add it to your pandemic operations, how you might add that plan to an existing disaster preparedness plan. We'll go over a sample plan and then a template that you can use when you're writing your own plans. We'll break out into small groups to go over that template in more detail and then discuss questions that you might have about this. And then we'll come back together to hear what each group discussed, and we'll do a last round of Q&A just to make sure any lingering questions are addressed. Katara and I have planned to spend 1 hour with you all today, and we're going to do our best to keep to that 1 hour goal. It's going to be packed full of information, so I'm going to get us started. Could you go to the next slide, please? So on September 7th, Governor Cuomo signed legislation which requires all New York State public employers to adopt a plan for operations in the event of a declared public health emergency involving a communicable disease. These plans are required by law, as I said, for all public employers. At this time, association libraries are not required to submit such a plan, but we are encouraging all of our libraries to develop a plan as a best practice. And we hope that today, the information that we give and the templates we provide are going to make that very easy for you to do. You can see the legislation on your screen now. It's very small, I recognize that. I didn't put it up there with the expectation that you would read it. Even if these were full-sized, this information would still be challenging to pick out the important bits and understand what's actually expected of us and what our plans need to include. So to make the process easier, I've pulled out the 7 requirements from the legislation and we're going to go over them quickly next. So if you could go to the next slide, please. So requirement number 1 states that your plan must include a list and description of all staff positions in your library that are considered essential, and you must provide a justification for classifying each of those positions as essential. The New York Library Association has created a really helpful list of definitions to use when you're completing your pandemic operations plan, and they've defined an essential position as a designation made that a public employee or contractor is required to be physically present at a worksite in the library to perform his or her job. Next slide. Requirement 2 indicates that your plan must outline the protocols your library will follow in order to make it possible for employees that are considered non-essential to work remotely. So essential employees need to work on-site in the library, non-essential employees are working remotely. So for this part of your plan, you'll want to consider things like providing physical devices that employees might need to use, software they might need, and then maybe you would need to transfer phone lines when necessary or practical, stuff like that. Next slide, please. Requirement 3 asks that your plan will outline how you might stagger work shifts for essential employees. So those that have to be on site, how can you stagger their shifts to limit the number of employees in the building at any one time? Number 4, please. So requirement 4 states that you must outline how you will obtain the necessary personal protective equipment or PPE for all essential employees. So in responding to this requirement, you should consider the types of tasks that each essential employee will be required to do. The requirement indicates that you must have at least 2 pieces of each type of PPE for each essential employee during each work shift and enough to last for at least 6 months. So there's a lot wrapped up into requirement 4. And we do recognize that for some smaller libraries, storing that amount of PPE might be quite difficult. So that's something you can flesh out and make a plan for in your actual written plan. Number 5, please. Oh, you're already there. Thanks, Katara. So requirement 5 asks that you outline the protocols you will follow if an employee is exposed to a communicable disease in order to prevent the further spread of that disease at your library. So what policies will be in place for disinfection of the library and then for any leave time that the affected employee might need to quarantine or because they are ill. Number 6. For this requirement number 6, you should outline the process that will be followed to document work hours and locations for essential employees that are working on site. This is going to help later with contract tracing. So just being aware of what time people are in the building, who they overlap with, and where they are. I mean, if they're in the building, you know they're in the building, but just in case you do have to engage in contract tracing later, it will be helpful to have a record of that. And then the final requirement. It's pretty unlikely that libraries are going to need to address requirement number 7. This requirement asks that employers consider how they would provide emergency housing for essential employees. So for most, if not all of our libraries, you can simply write not applicable under this section. Just a few other things to keep in mind as you're drafting your plans. They are due April 1st of 2021, so that you should have them finalized by then. They must be posted in a clear and visible location in your libraries and in your employee handbook. And you should also post your plan to the library website with other relevant policies like your disaster preparedness policy.
Okay, Erica, I will take over this slide. I don't see any questions yet in the chat, so I will continue as we go. So as Erica just mentioned, hopefully you all have an existing, disaster response, preparedness and response plan. If you don't, that's cool. We'll help you make one. Just let us know. But the pandemic response plan would be part of that larger plan. It would be integrated with that so you could respond to all sorts of emergencies. So why do we need this plan? I call this the 3 Ps. So planning and practicing will protect your employees, your patrons, and your organization. So being proactive to plan and practice will help you protect your all the people who are in your library and in your community. Things to consider as you're drafting your plan. Don't make it in a silo. I know we use that term a lot, so don't do it alone. Keep in mind that you'll want to discuss your planning with other community partners, including county health department, county emergency services department, a county manager or administrator, your school district, your mayor or town council, and other groups that may use your library regularly, such as the YMCA or daycare centers or Head Start. Get a communication channel going as you start to plan, so that when you have the plan and you need to use it, you've already established some good relationships and you know who to contact immediately in case you need their assistance. So communications, I mean, we're in the middle of a pandemic. I think most of us have been watching either the county health department announcements daily, or we've been watching the press conferences from the governor. That is information that we rely on to make safe decisions for our libraries, for our staffs, and our communities. So keeping that in mind, you want to continue to watch news, monitor reports, because your staff, your patrons, and the community are relying on you and the library to provide information such as adjusted hours, space capacity, safety protocols that will help them make safe decisions about how to use the library and its resources. So the community is relying on us to help provide library services safely, and we want to make sure we have all the information. And we also want to make sure that we're communicating, first of all, with the staff, the trustees, the volunteers of your library, because it can be difficult when they see something perhaps in the news about your library before they've heard it directly from the library director or the board. So try to keep all the staff, trustees, and volunteers informed as you're going on. Gathering input. So if we were doing this, a year ago, we could have said contact your county health department before a pandemic occurs so that they can help you plan. Well, we learned that, as we went, we've been in contact with them, and we'll want to keep in contact with them. So when this pandemic ends, sooner rather than later, we all hope, don't assume that we're never going to have another one. You'll want to keep the channels of communication open with the health departments, with key community partners and stakeholders, so that we're ready if there's another one. A plan that doesn't get tested and updated is not an effective plan. Most of us can remember fire drills in school. I mean, we knew what to do as soon as that bell rang, right? Why? Because we practiced, 3 or 4 times a year. That was constantly, a practice we learned every year, we repeated, and we were good at knowing what to do. So you'll want to implement similar precautions into your plans. So if you make this plan now, you put it in a binder on the shelf or even in your website but you don't look at it again for 3 or 4 years, it's not working. So you need to make sure everyone has familiarized themselves with it, and you'll want to revisit it annually for updates as staff changes, as your library facility may change in terms of the building footprint and updates. So you'll want to keep that in mind and keep this fresh. So putting the plan into action. Knowledge is power. So as I said before, know what is currently happening across the community, the region, the state, and nationally. I think we've all been doing really well at that lately. And you'll also want to talk to local healthcare professionals, people who work in emergency response, other nonprofit organizations, leaders of those organizations. Find out how they're handling things, how you might be able to learn or share your information, how you can work together. I think we've all done a lot of partnerships lately, which is great, and that's very important. Another thing I'll mention is risk assessment and risk management. If you have done a disaster preparedness plan, you have probably heard these phrases. It is something that you just want to consider. For instance, know your location specific hazards. So New York State has a website called Mitigate New York, where they rate what hazards are most likely to happen across the state. So the most costly hazards that happened in 2019, number one in New York State was hurricanes, which caused $166 million in damage, and then flooding and wind. So those are 3 things we can probably know we're going to face at some point each year or every other year as organizations.
Just to give you all an idea of what's possible as you prepare your plans, the Wyandotte Library has generously offered to let us share their plan, which is very small on the screen. But the point of it being so small is that you can see that it is short and to the point. It's 3 pages, nice and easy. The plan addresses each of the 7 requirements and keeps it nice and simple. Katura and I have prepared a plan template, which she's going to go over next. And it's a bit more detailed than this plan, but our template also attempts to boil things down to just the essentials. What I hope you'll take away from the slide with the Wyandotte plan is that writing your plan doesn't have to be super complicated or an onerous task. At minimum, just make sure you think about and address each of the 7 requirements. Everything else you add to the plan is like frosting on a cake. I personally think frosting enhances a cake to a great deal. It's my favorite part. So I encourage you to consider adding some of the extra components from our template that Katura is going to talk about. But just to give you an idea, there is a range of how your plan can look, and it doesn't have to be terribly long or detailed. Thanks, Katura.
Thank you. All right, great. So as Erica just mentioned, we have prepared a template for use by our libraries. Erica has prepared it in Microsoft Word. As you'll see, some places are highlighted in yellow. Those are areas where the text should be replaced to specifically apply to your library. And this document, you can see right away on the first page, we've got insert library name highlighted in yellow. So obviously your library, you are going to want to personalize that with your name. And the same goes for such as the date and the other information highlighted in yellow. You will want to personalize. The rest is sort of form language that we've created that can be used by anyone. But again, the yellow will be key for personalization. There is also a more detailed plan if you are a larger organization, larger library. Can you see this, Erica? Okay, there is a more thorough plan that you can use. We've provided a link to that as well. It is longer and has a little more detail, but we're trying to be mindful and give you something simple to work with as you get started.
Great, thank you, Katura. So the next part of the session, we're going to use Zoom breakout groups to move you all into groups of about 10 people. Each group will be paired with an STLS staff leader. So we have Brian Hildreth on the call, Lori Brown, Katura, and myself. So about 10 of you will be in each group with one of us. Once you get into your groups, we're going to assign a note taker and ask that you take some notes so that you can share bits of your conversation back to the larger group when we come back together. You'll review the pandemic plan template that Katura referenced, and I posted the link in the chat. You're going to go through that a little bit together, identify areas that you have questions about, and you'll be in your groups for about 20 minutes. And Katura, if you could go to the next slide. To get you all started, we've come up with a few discussion ideas, and your group leaders know about this, so there's no pressure for you. They're going to totally take care of you when you're in your breakout groups. But things you might talk about include mission essential functions, like what priority functions are required or necessary for your library to provide vital services. You might identify essential positions for staff or trustees who will perform the identified essential functions and then justify why those are essential. You might consider the workflow and protocol of all personnel who may work remotely to ensure that they're able to accomplish their duties effectively. And maybe you'll consider the variety of PPE required and how those needs will be identified. How much PPE will you maintain on hand? Where is it going to be stored? Who will have immediate access? And then who's responsible for monitoring and maintaining that stock of PPE?
Share out and questions. All right, group Brian, who wants to share out or ask any questions that their group discussed?
So I think I'm gonna share out, and I told them before I got the call, I failed to do my homework. I know I was supposed to assign somebody to share out, but I failed to do that, so I'm gonna be the one that shares out. We kind of just went through and kind of just did a little bit of a recap of the pandemic in and of itself to kind of talk through like some of the key things that were important that we experienced. And out of respect for everybody's time, I'll just go through this quickly. The thing that we liked about the template was, from an administrative standpoint, was one, creating the plan, not in a silo, like Katura said, but talking with DOH, local DOHs or emergency responders, but also working with staff and board and director together to create that plan. And then also, when the plan's created, the board approves it and acknowledges that it's the director's responsibility to implement it if it ever needs to be used again, hopefully not. And then we just identified like essential workers. We went through those job titles and descriptions of who's supposed to be doing what based on the situation where it's 100% workforce reduction. So only the most essential people can come in the building. And because most of the people in our room were from Chemung County Library District, they were given the opportunity to kind of like work through who those people would be and at what branches. But we all agreed, or they agreed, that keeping the job titles general, so especially for a big organization, the more specific you get, it doesn't allow for the timeliness of the plan. So locking themselves into something that may not happen for another 10, 20, 30 years isn't a good idea. And then also the other thing we really talked about was supplies on hand. And so going through this experience and now including the plan would be knowing like what you should keep on hand already if in the event another pandemic happens or a natural disaster, but then also knowing like your contacts, who you need to contact as soon as that happens again, because of the chain supply and it not necessarily being as robust as you want because of the global kind of chaos. And the one thing that CCLD mentioned, which they had done before as part of their natural disaster plan or their disaster plan, was they actually had kits set up at each one of their branches, which I thought was great. Unfortunately, all the stuff that they had stockpiled was completely irrelevant for the pandemic. So flashlights, Band-Aids, thermal blankets, none of that applied for this situation. But kudos to them for being super well prepared.
Yeah, we know where to go next time.
Yeah. And then the last thing we just slightly talked about is just what protocol looked like when staff returned to buildings. So being able to document some of that stuff now so they don't have to recreate the wheel if it ever happens again. So I think that's it. I hope I did a good job summarizing, guys.
Sounds great. Thank you. Lori, does anyone in your group or you want to share out? Let's see. There you go.
So I was talking and I was muted. I'm sorry. So let me tell you that Melanie was our recorder, and she's going to post in chat if I misrepresent anything that I say. She recorded, but her mic was having some difficulty. So we pretty much stuck to the questions as were presented, and we talked about who would be essential and who wasn't essential. For many of the people in our group, being essential was the director, but that didn't mean that you were necessarily in the building. Depending on where you were at any point of the pandemic, it allowed you to allow your staff in to be doing things while you could be working from home because your duties allowed you to do that. So their essential workers were the director, folks in their business office, so the bills would be paid. Any contracted services, especially as we're looking at coming into winter. So snow removal would be a contracted service for most of the libraries in my group. And someone who would be doing the cleaning or monitoring. Depending if it was a little further along in the not a total shutdown, essential staff would be frontline people either providing circulation and or curbside services. One of the things that was identified was by several directors was addressing their own work habits, being able to be done work at 5 p.m., not continuing to work on into the evening, and to adjust that balance. So there was some learning curve that wasn't really part of the plan, but it really was something that came out glaringly from our past experience. Other people had, as we went into this, did not have access. So the protocol of providing for people to work remotely, of being able to provide that and be prepared for that. Many people didn't have appropriate laptops and other things, and localized grant made that possible, but to be better prepared for the next time around and to have more on hand to do that sort of thing. We had one library who said one of the key features in communications was communicating with the board weekly and with staff and keeping everybody informed. That was really key for their successful continuation of services and information share. Okay, anybody in my group? Did I forget something essential?
Okay, we're going to move on for the sake of time. I will represent my group. We had some very interesting questions come up. One thing we talked about a lot was vaccinations, what to do when they are available. Can we compel staff, volunteers to get vaccinated? You know, how was that going to work? So we have some interesting things to look into for the future. And now, Erica, I'll pass it on to you.
Yeah, thanks, Katara. I also failed to assign a note taker. Sorry, group members. So just quickly, a couple things that we talked about was like struggling with the idea of stockpiling PPE, how much is actually necessary. We also discussed that sometimes trustees might be considered essential. So if you need for some libraries, a trustee has to double sign on a check. So how do you accommodate them in describing essential positions? And then Barbara Bradigan had a great suggestion. She has an in with the fire and emergency services, and they have one of those disinfecting guns. And so they are able to partner with that organization to come in and disinfect the library occasionally. And she talked about how it's a mutual benefit because the library is disinfected, and it also means that if there are less COVID cases, it's less of a risk for the fire and emergency services. So it might be an opportunity to look into a partnership on that level. Victoria, you're going to share your screen again? Awesome. Thank you. Great. So I did accumulate a few questions from the chat, and I'd like to share those with you all now. And then for Brian, Lori, and Katura, if you would chime in to help me answer these questions, that would be awesome. So the first one that came up is flu prevention supplies considered sanitizing equipment? And I think that was from Will at Prattsburgh. What are our thoughts on that, STLS folks?
Sorry, couldn't find my mute button. Flu prevention materials. So I'm sorry, do we know what she's referring to?
I don't. Will, if you're on the call, could you provide some clarification and we'll come back to your question?
There was a slide that specifically mentioned something about having to supply flu prevention supplies, and I was a little confused as to what that meant. Honestly, I wasn't sure. It was in one of the earlier slides. I don't know if I can go. Can I go back in yours?
That's okay. I think it probably it would be referred to things like disinfectant, masks, sanitizer, plastic shields, things like that. I don't think it was anything specific. Does that answer your question? So yes, they would be sanitizing equipment.
Thank you, Katura. So the next question is, are we required to post the plan in a space where the public can see it, or is it just posted for employees, for example, in the back room? And my understanding is that it's not for the public, it's for the employees. So you want to post it, and Brian, feel free to chime in, but it is in a place that is visible to your employees, both in the workspace and also in the handbook and on your website. So in your kitchen or in the break room or wherever your employees are able to see that easily. Does that sound right?
Yeah, I would say that sounds right. And I know many directors who are on the call are board presidents. You've heard me say, one of our greatest assets is just overall transparency. I'm a big believer in government transparency. It's what allows our community members to trust us as a trustworthy community resource. So I don't think that there's actually any harm in posting plans. I know if I go to some of our members' websites, or if you actually go to STLS's website, every plan or every policy we've ever formally adopted by our board or through our board is actually up there. There's nothing I think that can hurt you by posting that plan online. And quite honestly, if anything, if there's somebody out there that's really looking and they see the fact that you have it up there, it just adds a little bit of a feather to your cap. So I think it's indifferent, but I agree with Erica's sentiment, making sure internally it's well communicated out. But externally to the public, I would leave that up to you, but there's no harm in posting that to your website. If anything, it just adds to your transparency.
Thanks, Brian. Brian, if you want to stay on, I have two more questions that I think we'll ask you to help address. So the first one is, how do we comply with HIPAA when tracking absenteeism related to flu symptoms?
So can we get clarification on the exact HIPAA compliance it is?
Owen, could you chime in on your question if you're still with us? Patient privacy, he says in the chat.
Okay, so now I better understand it. Just repeat the question one more time, Erica.
How do we comply with HIPAA when tracking absenteeism related to flu symptoms?
And one more clarification, are we referring to staff or patrons? Is it more for like screening or contact tracing?
Owen says staff.
Okay. So yeah, this is a really gray area. And before I answer it, I would probably encourage, because you're chiming in from CCLD, if you guys are working with an employee assistance program, they might provide the best answer for you. But the other thing is I can reach out to our EAP and get a more specific answer for the entire group. And we can certainly share that out. But I think for us at STLS, and probably what I would encourage member directors and boards to do, and each one of you are a little bit different in how you operate because you're different libraries, but just coming down to the actual compliance, keeping the least amount of medical information on your employees is the best practice. One of the things that we learned through an HR audit here at STLS of our own practices was, and I think most of our libraries, our larger libraries practice this as well, is keeping personnel files completely separate from personnel files with medical information. So each person at STLS has a personnel file, but they also have a personnel file that is specific to the medical information that we retain for them. And we retain very little medical information on our staff, with the exception of emergency contact information or anything that would be relevant to reasonable accommodations. But that with that right there, that's the most that we keep track of. So, but Owen, we can certainly we'll take that question and we can look into it with our EAP and get back to you on it. I'm sorry that is not helpful as maybe you want it to be, but I just don't want to put out information that's not true.
Great. Thank you, Brian. And then the last question that I received in the chat, and feel free to put others in if you have more questions, but the one that I have now is, are libraries really expected to offer a significant amount of paid leave for their staff? So Brian, in the template that we provided, there's a large section on page 10 that talks about employee and contractor leave. And this was pulled from the template that we originally were using. And it talks about employees being provided with up to 2 weeks of paid sick leave. Can you talk more about if that actually applies to our libraries?
Yeah, I can. And will you just be able to confirm? So the prescribed time periods, most of them were like 2 weeks in duration. Where did that specific language come? Like, what template did that specific language come from?
Keturah, this came from that New York State template that had the multicolored highlighting in it that we originally shared with Brian and Lori. Do you know who provided that?
One second. It was made by sorry, I can't find it right now. I can look it up. It was prepared by a human resources firm, I believe, who was working with nonprofits.
That's okay, Keturah. I was just curious. I didn't want to not cite a source. So I can answer the question. So think of this in terms of, so if the question is coming from a trustee with over concern about paying too much to an employee while they're off, because I looked at those benefits and those payouts, and they certainly looked like maybe they were out of alignment with a typical rural public library would spend on benefit time under normal circumstances. My disclaimer is these are not normal circumstances. We've learned that over the last like 10 months. And so going back to the original guidance the STLS gave libraries, as soon as we got a legal opinion, and it sounds like this template has that legal opinion both through HR professionals as well as legal counsel. Stephanie Cole Adams was the legal opinion that we had received, and it's been held up across the state so far, is that is because New York State and the federal government declared a state of emergency, the payout times are completely legitimate using taxpayer funding. And a lot of this revolves around whether or not libraries could actually pay employees just to stay at home and do I don't want to say do absolutely nothing, but there were some employees who really just couldn't do their work and staying at home. So that was perfectly fine to do that. Until I get better understanding of exactly where this guidance came from, but it's clearly been vetted through both legal counsel as well as HR counsel. I would say that probably that's something that you would have to hold true to.
Brian, the providing institution is on the screen now. It's Emergency Preparedness Solutions, LLC.
And this was the organization I believe was contracted with the New York State Department of Labor.
Yes.
I have a question, Brian. So can we ask them to work from home during those 2 weeks if we have work that they can do? Or are they just paid time off during those 2 weeks?
Great question. So, and I think that question helps put a lot of board members' minds at ease because they are good stewards of taxpayer dollars. I think that should be part of your pandemic plan. It was something I was hoping to get my discussion group to, but we just didn't get there. But like part of your pandemic plan, so we talk about identifying who are essential personnel in that plan, but nothing within the template identifies what non-essential personnel, who are non-essential personnel are, and what non-essential personnel should be or should not be doing when they're given stay-at-home orders. You know, we did that here at STLS. We paid all of our employees through stay-at-home orders, but 95% of all of our employees were able to work remotely from home and do the equal or more work than they were doing in the building, with the exception of our delivery drivers. And so we found things that delivery drivers could safely do within our building to be compensated. And we kind of considered them maintenance staff. So I would say, as part of Tina, to specifically answer your question, yes, you can ask them to work because, you know, you have that implied contract with them as an employer, but you also have to provide them with work that they can do from home safely. So if there's work that requires them to go out of the house and engage with patrons when they shouldn't be or something like that, you can't ask them to do it. But everything from getting ready for when the pandemic's over and story hour cutouts, or or hold slips, or just finding the littlest tasks that they could potentially do at home, so long as you can outfit them with the resources to do it at home, that's perfectly fine. And I think pandemic plans should, like right now, the template doesn't say that, but it certainly does a good job of addressing who essential personnel are and what they can do in the building if there's a 100% workforce lockdown. But it doesn't address what non-essential employees should be doing at home. And I think that's a good place for rural libraries to start, especially so if we do run into a position again where we're like this, board members don't have to ask that question, do we have to pay staff if they're doing nothing from home? Hopefully your plan outlines what they can be doing from home and safely.
Thank you, Brian. Nick Gunning posted in the chat asking, isn't there already a change in paid sick leave starting in 2021? And then provided a link to that.
Yeah, this language actually came from the family's first coronavirus response. And it expires actually on December 31st. So we might want to check with Stephanie to see if this is still going to be in effect after that or something, because this just came exactly from the act. This is the exact wording. So that's where I think she got it from. And I agree with you, Brian. If there's work for them to do at home, I think that's what we should do.
Thank you, Sherry. Thanks, Brian, also, and thanks everybody for your questions. I know we all want to get out of here because we're running a little bit over. I just want to make a few last minute comments. So on March 4th of 2021 at 1 p.m., Katura and I are going to host a virtual coffee hour where you can just drop in and tell us how it went writing your plans. If you haven't written your plan, it'll be a nice reminder that it's due on April 1st. But mostly we just like to celebrate that you finished them and hear how it went. And on the next slide is our list of links that we used in preparing this presentation. The slides are available at the link I provided in the chat earlier on the STLS website. If you want to look at any of these links later, you can. And the last slide is just Katura and I's contact information, which you can also find on the STLS website. Please feel free to reach out if you have questions. And thank you all so much for spending time with us and spending even 10 minutes extra than you had planned. We really appreciate it.